Hello, my name is Roslyn Young Daniels, and I'm the president and founder of Black Health Matters. I'd just like to take a few moments to talk to you about my journey and to share why I felt it was just my life's work to launch Black Health Matters. We launched Black Health Matters in 2012 because of the Affordable Care Act, understanding that African Americans and all Americans would have access to health care, but none of that matters unless there's a fundamental understanding of what healthy behaviors are. So, unless you have a level of health literacy, it really doesn't matter how much access you actually have. So, we launched Black Health Matters to be that roadmap and the North Star for thousands of African Americans looking to embark on a journey for better health. When I think about growing up, one of the things that was really impressionable were my relationship and the things that I used to do with my grandmother and my grandfather. I loved them dearly, and unfortunately, they just left too soon. And I know many of you all have experienced the same thing. When my grandmother and grandfather were both admitted to the hospital at different times, neither of them lasted more than 2 weeks. And I felt at that time as a young girl, if my parents had known better, they probably could have helped my grandparents live longer. The same with my grandfather. When he was admitted, he died too soon. And so we felt that I felt that launching Black Health Matters in 2012 would be a way for me to pay it forward for thousands of families who lost loved ones because they just didn't have the information and the resources to press the medical system to do the right thing for their loved ones. We decided when we launched Black Health Matters that we would be an online platform. The idea that we needed to have content that was self-reflective. I grew up reading Essence and Ebony, and those publications meant a lot, again, because I got a chance to see myself. So when we decided to launch Black Health Matters, we understood that that also would be important. Our content is evidence-based, and it reflects the lifestyles and the diet, nutrition, how we spend our recreational time, how we feel about our families. All of that is embodied in our writing. Next, we decided that we needed to share this information on social. So we post thousands of articles on a regular basis to hundreds of thousands of people that come to our Facebook pages, our Twitter feeds, and our Instagram. So our social connections are so important to us. It allows us to reach people who wouldn't ordinarily see information about heart disease, HIV, AIDS, mental health come up on their feeds on a regular basis. Next, we decided that we wanted to partner with community organizations. That includes fraternities, sororities, faith-based centers. That allows us to actually have tentacles and boots on the ground because change really happens 1 minute at a time, one person at a time. So we seek to establish a community of health so that people can actually talk to each other and feel more comfortable and less afraid to have conversations about pain that they may be facing. Our communities, again, our fraternities, our sororities, our civic organizations allow us to further penetrate patient communities. The great thing is that these organizations are so very much committed to service that we help them build capacity to reach even more people with programming that's interesting and exciting. The last thing we created, or the most recent thing we created, were the Black Health Matter Summits, and we've been doing those for more than 3 years. The goal with our summits was to disrupt the space, disrupt how people think about learning about health and wellness, disrupt the way that we actually listen to clinical conversations and presentations. I have the ability and the fortune to be able to attend a certain number of scientific meetings because that's kind of what I do. And so when I go to those scientific meetings, I'm always amazed at how scientists are able to talk about molecules or an advance that's coming up for cancer or new treatments for autism or Alzheimer's. It's really mind boggling, but it's also so exciting to understand how science is paving a way for us to live healthier lives. I wanted to be able to connect those scientists and their message with the African American community. And what's the best way to do it? Is to showcase them. So we started the summits to be a showcase for this exciting, novel health information that would make a difference to so many because we do tend to have segments of our audience of the African American community that are medically underserved. We found expert physicians that literally you would feel they're like the James Brown of medicine because when they're done, they could drop the mic. So they will get you charged. There's just electric in the air. And after you hear them talk about what lies ahead for people who participate in clinical trials, that access the best care possible, that maintain their physical exams, that stay on their prescription medications as prescribed, that there is so much that will be rewarded by these healthy behaviors. And so we continue to do our summits because they do have impact. We understand from the information that we receive from people that attend that our summits are completely transformative and that people really feel that they're going to take what they've learned and make it happen. So those are just some of our experiences as we build our brand. But we can't do it without you. We thank you for your support because we are literally building a movement. We want everyone to understand how important health and wellness is. As a people, we have built this country. We have so much to offer, and our future generations will do the same. So please keep in mind to share with your friends, neighbors, the country, and the world that Black health matters.